gave a report in our press release yesterday. We've had 121 new cases of the coronavirus infection reported in Philadelphia residents, bringing us to a total of 23,281 since the beginning of the epidemic. Now, that 121 is quite a bit down from the 500 to 600 cases we were getting reported per day back in mid-April when this epidemic was peaking. At one time, about 40% of the people in Philadelphia who were tested for this infection were positive. Now we're down to about 7% of people testing were positive. I don't have an update on the number of people with this infection in hospitals in the city this morning. That data is delayed, but I can tell you overall the number of people hospitalized is about 60% lower than it was at its peak. We've had fewer cases in our hospitals, nursing homes. As far as the deaths in the city, we did another one of these matches of databases in the past day or so. And with that, we have identified 70 new deaths from coronavirus since the beginning of the epidemic. Most of those occurring sometime over the past month, not in the past couple of days. That brings us to a total of 1,394 deaths since the beginning of the epidemic, of which 739 or 53% were nursing home residents. At the peak of this epidemic, we were getting about 35 deaths per day. Now we're down to below 10 deaths per day. We may be 1 or 2 per day. So we're clearly overall on the decline, as much as we don't want to see any deaths. In our hospital emergency departments, we're seeing very low numbers of people coming in with symptoms that are compatible with a coronavirus infection. So last Friday, we announced that we had a plan for us moving to the yellow phase if the numbers continue to look good. And if the numbers do continue to look good, we do think the numbers justify us moving to the next phase of our response to this epidemic. Now, a number of people have asked about the protests that have occurred in the past week and the risks of protesters and the risk of that potentially igniting more spread of the virus. We do have concerns about that. I'm worried about that. It's my job to worry. However, I've noticed in the protest that many protesters were wearing masks. In many cases, they were keeping their distance from other people. We have made a recommendation that people involved in the protest, that they stay away from other people, that they monitor to see if they develop symptoms, and that they be tested 7 days after they participate in the protest. And so we'll watch, but I'm hopeful that we don't see increased spread involving from the protest. And I don't think that that should change our overall decision about us being able to move to the yellow phase. Now, last week we announced our strategy for how we will move to the yellow phase. That's our safer at home strategy. It has 3 elements to it. It has containment, which involves testing and contact tracing and isolation and quarantine. It involves social distancing. That's the gradual scale back of restrictions with some metrics and some early warning signs that would tell us if some of our step back has caused increased spread of the virus. And it involves the 3rd element, which is protecting vulnerable populations, including racial and ethnic minorities, and including people in nursing homes and other congregate settings. In all of our settings that are going to reopen, we have a safety checklist that we talked about last week. And we're going to be promoting and requiring people to follow the rules in that safety checklist. It involves masks, barriers like the plexiglass you might see at cash registers, distancing, reducing crowds in buildings, so no more than 5 people per 1,000 square feet, isolating people, that is to say, screening staff before they come to work for symptoms and having them stay home if they have symptoms, hand washing, cleaning, and communicating, particularly putting signs up in places like stores to let people know what the norms of behavior are. What people will see as Philadelphia residents is in retail stores, there are many retail stores, we're encouraging them to have it be where people order ahead and do curbside pickup, but people can go in stores. If people go in stores, you should see differences. You should see limits on the number of people in that store, no more than 5 people per 1,000 square feet. You should be prepared to see people wearing masks. You should be prepared to be required to wear a mask in stores. That's a key part of all this. The employees should be wearing masks. And you should be seeing barriers at the cash registers. Now, in addition to retail stores, what will be allowed to be opened as of tomorrow will be daycare centers and outdoor day camps, each with their own safety checklists, and offices, although we are still encouraging people who can work remotely to do so, and manufacturing and warehouse operations. In addition to that, we'll continue with services and the activities that are allowed now. So restaurants can provide takeout food, people can order on site, mobile food will be open, and construction and repair will be open. What does this mean for individual Philadelphia residents? Three things to remember: masks, distance, and hand washing. Now, one area that we do differ from the governor's, what the governor is allowing, is the governor is allowing gatherings of up to 25 people. Those are allowed in Philadelphia under the yellow phase starting tomorrow, but we don't recommend those. Those are settings where no one is monitoring it. There's no really established safety checklist. And there can be certain gatherings, particularly indoors, that can be very high risk. So people, they can do this if they want, but we strongly recommend those gatherings in this phase. Now we will, as we allow those activities to restart, we're going to monitor very closely our overall metrics, and we're going to monitor our early warning signs. I just want to establish for everyone here right now to know that if we do see a big increase in the spread of the virus, we may have to backtrack and we may have to put more restriction on people's behaviors. So none of us wants to see that happen, and the way to have that not happen is for people to really take the safety checklist, the safe mode guidelines seriously. If we all do this right, then we all benefit and we can really restart our economy while keeping the virus at bay. So what we're announcing today is a small step forward, but is a very real step forward. We've been through some very tough times with this epidemic, but I'm hopeful that we're really finally making some real progress towards a return to normalcy. So if everyone follows the guidelines, I'm very hopeful that we can soon follow this with more. Thanks very much, and be happy to answer any questions later on.
Thank you, Dr. Farley. We're going to now turn it over to Managing Director Brian Abernathy for a few remarks today.
Thanks, Kelly, and thank you, Dr. Farley. After more than 2 months under a stay-at-home order, we know Philadelphians are ready to get back to work and back to more of their normal daily activities. Last week, Dr. Farley and Mayor Kenny gave a thorough overview of our plans for reopening. I want to touch on 2 things today to help round out those plans, both outdoor dining and an update on our own plan for city employees. Given the events of the past week, our team has been delayed in finalizing guidance for outdoor dining in Philadelphia, which we had hoped to produce this week. In addition to the legal and logistical aspects we had to work through, we also had some concerns about allowing outdoor dining to resume this weekend while demonstrations are still ongoing. Instead, we intend to allow outdoor dining to resume for businesses with existing outdoor seating beginning next Friday, June 12th. Our additional guidance, which will include options both for existing outdoor dining setups and new strategies for restaurants that do not currently have outdoor seating, will be shared as soon as it's available. The city is working on a streamlined process that would expand the availability of outdoor dining for businesses that are not currently permitted. 2 bills related to outdoor dining have also been introduced in City Council, and we have reached out to our partners in Council to make sure that we are all aligned and moving in the same direction. I know that this delay is disappointing for some restaurants and staff, but we believe that this extra time will allow us to create a more streamlined and safe process. I also want to take an opportunity to thank all of those businesses that helped us develop these guidelines and these processes, as well as the Commerce Department, departments of L&I, Streets, and the Office of Transportation, Infrastructure, and Sustainability, all of who have worked for weeks to get us to the point that we are today, and we're happy that we're close to the finish line. I also want to provide an update that our phased return of public-facing city operations originally will begin on Monday, June 8th. Again, our phased return of public-facing city services will begin on Monday, June 8th. We originally said that that would begin Saturday, June 6th, but given the fact that city buildings have been closed all week, we've pushed that back slightly. Unfortunately, I do have some sad news to share with all of you today. Yesterday, we lost another city employee to COVID-19. Police officer Jose Novoa of the 9th District was 62 years old and served as a police officer for 27 years. He leaves behind a wife, 2 daughters, and 2 granddaughters. Our thoughts are with Officer Novoa's loved ones, as well as his brothers and sisters in the police department. I also want to take an opportunity to personally give my thoughts and prayers to firefighter Gore, whose death Mayor Kenny announced yesterday. These are incredibly trying times for all of us, and the loss of another member, two members of our city government family is truly devastating to us all. And that concludes my remarks, and we'll be happy to answer questions following Armando's translation.
Thank you, Brian. We will now turn it over to Armando, who will deliver the Spanish language translation of both Dr. Farley and Brian Abernathy's remarks.
Actualización en materia de salud para el jueves 4 de junio del 2020 y breves notas sobre el pase a la fase amarilla. Buenas tardes. En general, hoy traigo buenas noticias. Hemos estado atravesando tiempos muy duros, pero las cifras del COVID-19 han estado mejorando. Vemos un retroceso en la epidemia. Desde ayer se han confirmado 121 casos de coronavirus en Filadelfia y actualmente tenemos un total de 23.281 casos en la ciudad. Esta es una disminución muy grande en comparación con el mes de abril, cuando estábamos reportando entre 500 y 600 casos diarios. Pasamos de tener resultados positivos en el 40% de las pruebas realizadas entonces al 7% al día de hoy. Y no tenemos nuevos casos del COVID-19 en las cárceles. Los casos en los hogares de ancianos también están bajando y las hospitalizaciones han disminuido en un 60%. Sin embargo, lamentablemente, reportamos 70 muertes por la COVID-19 en la ciudad. Hay un total de 1.394 personas que han muerto por la COVID-19. Muchos de estos fallecimientos ocurrieron el mes pasado y se pudieron identificar gracias al cruce de datos. 739 o el 53% de estas muertes han sido en hogares de ancianos. La disminución pasa de 35 muertes diarias que se reportaban a mediados de abril a menos de 10 muertes diarias en los últimos 10 días. Las visitas a los departamentos de urgencia por el COVID-19 también siguen siendo bajas. Y el viernes pasado anunciamos nuestro plan para pasar a la fase amarilla, más seguro en casa, si los números eran favorables. Y los números así lo justifican. Pero ahora estamos preocupados por un posible brote del COVID-19 entre los manifestantes. Muchos usaron máscaras y trataron de mantener la distancia social. Recomendamos observar si tiene síntomas y, de ser así, a realizarse la prueba. Nosotros continuaremos monitoreando la evolución de la situación, pero no hay razón para retrasar el cambio de fase. Quiero compartir nuestra estrategia del plan Más Seguro en Casa. La parte de la contención incluye la administración de pruebas, el rastreo de contagios, la cuarentena y el aislamiento. La distancia social incluye la reducción de las restricciones, el monitoreo de cifras y las señales de alerta temprana, y la protección de las poblaciones más vulnerables, que incluye a las minorías étnicas y raciales, los hogares de ancianos y otros entornos congregados. Asimismo, les rogamos implementar las mejores prácticas del plan Más Seguro en Casa. Vamos a promover y vamos a exigir el uso de una lista de verificación de seguridad para los comercios que incluye el uso de máscaras o cobertores faciales en los establecimientos comerciales, la instalación de barreras de plexiglas, el mantener la distancia social en todo momento, el aislamiento cuando sea necesario, el lavado de manos frecuente, la limpieza exhaustiva de las superficies y de los locales comerciales en general, y una comunicación clara y efectiva con el público. ¿Qué es lo que verán los residentes de Filadelfia? En las tiendas minoristas o al detalle, que las órdenes se realizan con antelación y que la entrega de productos al cliente se hace sin tener contacto con él. Un límite al número de personas que pueden entrar en los establecimientos. 5 personas por cada 1.000 pies cuadrados. El uso de máscaras o cubiertas faciales en todo momento. Y las barreras de plexiglas para las cajas registradoras. Los centros de cuidado de niños, las guarderías y los campamentos de recreación al aire libre estarán abiertos. Algunas oficinas podrán volver a operar, pero se recomienda el teletrabajo o el trabajo remoto en tanto que sea posible. Las fábricas y almacenes estarán autorizados para funcionar. A todo esto se suma la flexibilización de las restricciones para los restaurantes, los food trucks y los trabajos de construcción. ¿Qué es lo que recomendamos nosotros? El uso de máscaras o cubiertas faciales, el mantener la distancia social, el lavado de manos. Y vamos a seguir recomendando que no se realicen reuniones sociales o religiosas, Están permitidas las reuniones de hasta 25 personas, pero no se recomienda hacerlas. Vamos a seguir monitoreando y prestándole atención a las alertas tempranas. Es posible que tengamos que retroceder con nuestros plazos si hubiera un repunte de los casos. El paso a la fase amarilla es un pequeño paso, pero a su vez es un gran paso hacia adelante. Si todos cumplen con los lineamientos, en el futuro vamos a poder avanzar más y más rápido. Y este es el mensaje del director general Brian Abernathy para el jueves 4 de junio del 2020. Buenas tardes. Después de más de 2 meses con la orden de permanencia en casa, sabemos que los residentes de Filadelfia ya están listos para volver al trabajo y a reanudar sus actividades normales. La semana pasada, el Dr. Farley y el alcalde Kenny nos dieron una descripción completa de nuestros planes para la reapertura. Quiero mencionar 2 cosas hoy para complementar lo que se ha dicho ya sobre el servicio de comidas al aire libre, además de darles una actualización de cómo este plan afectará a la fuerza laboral de la ciudad. Debido a los tristes acontecimientos de la semana pasada, nuestro equipo se ha retrasado en finalizar la orientación para los restaurantes en Filadelfia respecto al servicio de comidas al aire libre, que habíamos esperado compartir con ustedes esta semana. Además de los aspectos legales y logísticos, también nos preocupa permitir este servicio y que se reanude este fin de semana mientras las manifestaciones aún continúan. Nuestra intención es permitir que los restaurantes reanuden su servicio al aire libre a partir del próximo viernes 12 de junio. Estas directrices incluirán opciones tanto para los restaurantes que ofrecen servicio de comidas al aire libre, como nuevas estrategias para restaurantes que actualmente no ofrecen ese servicio. Y todo esto se compartirá tan pronto como esté disponible. Se han presentado 2 proyectos de ley relacionados con este tipo de servicios en el ayuntamiento y nos hemos comunicado con nuestros aliados en el Consejo Municipal para asegurarnos de que todos estemos avanzando en la misma dirección. Sé que este retraso es decepcionante para algunos restaurantes y sus trabajadores, pero creemos que este tiempo extra nos permitirá crear un proceso más ágil y más seguro. También quería comentar que el regreso gradual de nuestros servicios públicos comenzará el lunes 8 de junio. Originalmente habíamos dicho que comenzaría el sábado 6 de junio, pero dado que los edificios de la ciudad han estado cerrados toda la semana, hemos tenido que retrasarlo un poco. Lamentablemente, también tengo algunas noticias tristes que compartir. Ayer perdimos a otro empleado de la ciudad por la COVID-19. El oficial de policía, José Novoa, tenía 62 años de edad y se desempeñó como oficial de policía por 27 años. Él deja una esposa, 2 hijas y 2 nietas. Nuestros pensamientos están con los seres queridos del oficial Novoa, así como con sus hermanos y hermanas en el departamento de policía. Para ellos va nuestro sentido pésame. Este es un momento increíblemente difícil para todos nosotros y la pérdida de otro miembro de la familia del gobierno de nuestra ciudad es realmente devastadora. Pero hay que recordar que pese a todo, las cosas van marchando como debieran y que solo juntos podremos superar esta gran crisis. Gracias.
Thank you so much, Armando. We are now going to move to the Q&A portion for members of the media who are logged in today. I want to remind everyone that this briefing is for COVID-19, so any questions related to the ongoing demonstration should be directed to the 2 p.m. press conference. And please remember, we do have limited time during these briefings, so only 1 representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those of you logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you're able to for broadcasting purposes. We will now start with Cheryl Spreitzer of 6ABC.
Hi there, how are you? Can you hear me?
Yes, Cheryl.
Okay, the first question is for Brian. Brian, what message do you want to put out to business owners about curbside retail starting up tomorrow that may be a little concerned about opening up given the circumstances going on in the city? We see a lot of places boarded up, clearly not ready at this point.
And I think the message I would send is obviously the situation between COVID and the ongoing civil unrest have been kind of have crossed over to each other. I think we want to make it very clear that as far as health department guidelines are concerned, that we are making pretty dramatic improvements here in Philadelphia, and that we're looking forward to businesses being reopened under the guidelines that we issued earlier this week. I guess last week at this point. But there may be restrictions as we are tackling the ongoing demonstrations, and those restrictions and those suggestions may differ depending on what part of the city you may be in. And so, what I would encourage is for businesses to be smart, to be thoughtful in their approach, to not rush. And if they have concerns about their own safety or their workers' safety or the safety of their merchandise, then they probably shouldn't open yet. I think over the last couple of days, we've seen largely peaceful protests and people who just want to make sure that we're listening to them. And so I don't have as many concerns, but certainly those concerns are valid for retailers, and we would continue to we'll continue to provide guidance each morning as the situation on the ground changes.
And then just to follow up on the outdoor dining, is the city going to do anything if they see restaurants filling their patios this coming weekend? Are you going to issue violations? What do you want to say to restaurant owners that might try to start outdoor dining this weekend? Restaurant
owners should not operate outdoor dining this weekend. They should not, and we will, if we're aware of it or become aware of it, we're going to shut it down for a host of reasons. One, the ongoing demonstrations. We do expect some significant demonstrations over the weekend, although we expect them to be peaceful. Certainly outdoor tables and chairs will interrupt that, as well as because we have not issued guidelines for restaurants yet. So certainly we'll shut them down if they open up.
Thank you. My last question is for Dr. Farley. Dr. Farley, given that a lot of pharmacies and the city had to close testing sites, do you expect numbers to increase significantly next week, that when people can start getting tested for COVID again?
So a number of test sites closed, but a number of them are still open. So all the city's health centers are open for testing today. Most of the other federally qualified health centers, their testing is open today. And we will follow the case counts, but we'll also follow the percent that are positive. And so if a lot of people get tested in a day, we can take that into account as we're tracking this. So there's a number of metrics.
Okay, great. Thank you, guys.
Thank you so much, Cheryl. We're going to go next to Natasha Brown at CBS 3.
Hi, I'm sorry, can you hear me?
Yes, go ahead.
Hi, sorry. This is for Brian, I believe, or maybe Dr. Farley, just in reference to some of the pharmacies now that aren't open around the city, just in light of looting or a lot of closures. People aren't able to get their medications. They're concerned about that, trying to figure out how to get to a place that is open. Has the city done anything to try to help with that part of what's happening here over the last few days or so?
We have. So we've been in contact with pharmacies to see which ones are open. We have a list on our website. So if people go to www.phila.gov/health, look on the blogs, and there's a list of all the different pharmacies that we know of that are open. And there are dozens of pharmacies that are still open. And we give people general guidance as well. So the first place you should go if your pharmacy, your regular pharmacy is closed, is to another store in the same chain, because they have a database and they'll be able to fill your prescription without any additional complications. If you can't find a store in the same chain that's open, then you can go to a different chain. They may have some difficulty getting the information from your regular pharmacy. If that doesn't work, then you can talk to your healthcare provider and have him communicate the information to the new pharmacy. But all the chains, Rite Aid, Walgreens, CVS, they all have stores that are open. CVS is delivering, the others may deliver. So although it's going to be inconvenient, people can get their medicines filled.
Okay, and then one other thing for you, Dr. Farley, just in reference to what we're seeing here with the protests and things like that, and the large gatherings of protesters. Just to be clear earlier, are you suggesting that anyone who's been in this setting get tested, or are you just suggesting that they just kind of monitor their own situation and their own health for a few days or so?
We're suggesting both, that they monitor their symptoms, that they stay away from other people so that if they do get the infection, they won't have passed it on to anybody else. and that they go in for testing 7 days after the protest, so that if they got the infection and didn't know it, it would be diagnosed. Excuse me.
Okay. All right. Thank you very much. That's all I have.
Great, thanks, Natasha. We're going to go next to Jason Laughlin of the Inquirer.
Hi, can you hear me?
Hey, Jason.
Hi, two questions. One, in regards to the effect on protesters, is the city going to be making any particular efforts to track those test results? Like, will that be a question for people who get tested going forward, so you can find out what the effect of the protests were on infection rates?
No, we're not going to be asking people whether they were involved in protests or not. I think that's a pretty a personal question. We'll follow the positivity rates overall. And so if this had an important impact, we'll see it on the overall positive rate.
And the second question, you said you do not recommend the state's recommendation of gatherings of 25 people or less. Is there a number of people in a gathering that you think would be acceptable in Philadelphia that you would say is okay?
You know, we're not recommending gatherings of social gatherings of people outside the household at all. You know, people can use their judgment, but I want people to communicate to people that we don't think right now it's a good idea.
Thank you.
Thanks, Jason. We're going to go to Hannah Seawald of the Temple Update.
Hi, yes. My question's for Dr. Farley. So just to clarify, even with people wearing masks and relatively social distancing, are you expecting a resurgence of cases at all?
You know, it's very hard to predict what this virus is going to do. So I can't say we're going to expect anything. We're going to be prepared for whatever happens, and we're going to be monitoring it very closely.
So are you looking to possibly then like take back some restrictions, like take back some of the yellow precautions? Are there any precautions you have already thought out of as to how you will adapt to depending on if there is a resurgence?
It really depends on what populations we're seeing a resurgence in and what we think is causing the transmission. I just really want to prepare people that this isn't always a step forward progress. Sometimes it's 2 steps forward, 1 step back. We hope we don't take any steps back, but if we do, we want people to know that that possibility exists.
Right, definitely. And just one more question. So if there's a concern, you know, because people could be protesting multiple days, they can't fully isolate themselves because a lot of people will be going back day by day. What do you recommend towards them because they can't fully, if they're starting to feel symptoms, like what should people do if they want to continue protesting multiple days?
Well, I definitely would not recommend that anybody who's having symptoms participate in protests because that's going to be putting their fellow protesters at risk. They really should not do that. I recommend that everybody who's protesting wear masks and keep a distance. That's our general recommendation for everybody. It's certainly under these circumstances. And again, if you know, people should go in 7 days after their exposure. Now, if they continue to go for 7 days, they may want to go at the day 7 nonetheless for testing.
Okay, great. Thank you so much.
Thanks, Hannah. We're going to go now to Rudy Chinchilla of NBC 10 Telemundo.
Hi, everybody. So I'll ask one question. I'll ask in both English and Spanish. So the question is for you, Dr. Farley. Knowing that the incubation period of COVID-19 can be up to 14 days, what do you say to people who will be concerned knowing that will be concerned about visiting businesses and the such, knowing that in just the last few days, people have been out and potentially spreading the virus through protests. So, en español, Armando, la pregunta es, dado las recientes manifestaciones y sabiendo que el periodo de incubación del COVID-19 puede durar hasta 14 días, ¿qué le puede decir a la gente que tiene reservaciones en cuanto a visitar tiendas u otros negocios empezando mañana?
You know, the virus is here and the virus is going to stay here. So there's always going to be a risk that somebody may be able to be transmitting the virus, which is why these safety guidelines are so important. We're going to have to be living with these guidelines for a long time. I don't think our strategy changes because of the protests, but you know, we do just, it sort of reinforces the idea of how serious we need to take these guidelines. We know the infection can take place with people not having any symptoms, and people can spread the infection at a time when they have no symptoms. So everybody needs to be serious about the masks and the distance. We do think that if everybody follows the rules, overall, we can continue to contain the virus.
Para Audiencia en español es si hay alguna preocupación debido a que el periodo de incubación del virus es de hasta 14 días y en vista de las manifestaciones hay preocupación de las personas que pudieran estar visitando los negocios de poder agarrar el virus. Y la respuesta del Dr. Farley es: el virus está aquí, va a permanecer con nosotros, siempre va a haber un grado de riesgo, para eso tenemos nosotros directrices que nos van a ayudar, porque puede ayudar a impedir la transmisión de este virus, por lo tanto es importante cumplir con ellas por un largo tiempo hacia adelante, hacia el futuro. Y las personas que están haciendo protestas, que por favor observen las pautas para impedir la infección que se siga esparciendo, porque muchas veces pueden estar no teniendo síntomas y de esta manera se hace manteniendo la distancia social y utilizando el cubrebocas. Gracias.
Gracias, D. Armando. Thank you, Dr. Farley.
Thanks, Rudy. We're going to go to Jack Tomsick now of Metro.
Just a quick question. Can you repeat the name of the officer and spell his first and last name for us?
Sure, it's Jose Novoa. Jose Jose, and Novoa is Noboa. I'm actually just, yes, that's correct.
Okay, thank you.
Of course.
Thanks, Jack. We're going to move to our second round of questions now. Jason Laughlin with the Inquirer.
As businesses reopen, if there are workers that still do not feel comfortable working in the environment, but their employer is open, is there any protections against for those people being fired or disciplined if they don't feel safe going to work?
No, I think we are trying to do our best to make sure that employers are flexible with their employees, that they have generous sick leave policies. We have made some provisions in our Office of Labor to make sure that appropriate safeguards are being made, and the Health Department, L&I, and some others will also be on hand to make sure that businesses are educated appropriately about what they need to do. But I certainly recognize the challenges that we're going to get into when employees don't feel comfortable going to work, whether that's because of outright malfeasance or inappropriate steps that their employer has taken, or just because they're not comfortable with the current situation. I think we're in a better position to manage those instances where the employer may not be following appropriate guidelines. It becomes very difficult for us to, and will be challenging for us to be able to intercede for employees if that employer is taking appropriate steps.
If I could add, not an enforcement role, but just a communication issue that we do think is important, is that we've heard that some employers want to require their employees to be tested and be negative in order to return to work. We don't recommend that. We know the test for that infection can remain positive for a long time, even after they're no longer infectious. And we think that the safety guidelines are far more important than testing. So any employer hearing this, we don't recommend that you require your employees to be tested in order to return to work. Just make sure they use the masks and follow the rules.
Jason, did you have another question?
No, that's all. Thank you.
Okay. All right, we're going to go to Martin Pratt of Philly YBN.
Can you hear me?
Yes.
Okay, thank you. Thank you for doing this. So today I saw in WHYY that the mayor is proposing to reduce the PAC budget. Is there any comment from you, Bryant, on why the Police Advisory Committee or Commission is being reduced, especially at this time?
So I think we are going to be addressing the civil unrest at a later press conference, Martin, but I know you can't always make it, so I'll answer it here. But I do want to put that pin in that comment for the other news outlets that can make it to that press conference. So the Police Advisory Commission did see I think a 20% reduction. I instructed most of our operating departments to do something similar and to propose cuts to their budgets. And I would also say that remember that we are in a $650 million deficit. And so we have had to make a lot of painful cuts. The Police Advisory Commission still is better funded today than it, even if the budget should pass, than it was in FY16 when we took office. And so certainly isn't meant to denigrate or say that the office isn't worthwhile. It certainly is worthwhile, and I think that civilian oversight is really important for our police department going forward. But again, we had to cut a lot of things that I think are really important. Certainly this budget was proposed before any of the current circumstances. So will we make changes? Possibly. We're certainly open and listening to other proposals, and this is a process. We made a first introduction, but to try and relate, that we are. I do the implication that a certain reporter made that we are tone deaf to the current situation because of the PAX reduction, I personally find insulting and think was completely uncalled for. Really, I've done a lot to try and to empower the Police Advisory Commission. I will continue to do that even when I disagree with them, which I do often, but certainly recognize the importance that they play in civilian oversight of our police department.
A COVID-related question. Thank you, Brian. COVID-related question for you. Have you seen the increase in the sanitation department numbers as far as people staying home because of being sick?
So our numbers have been relatively consistent over the last few weeks. So we did see some small improvements. But we still have a number of folks who are calling out. We still have some staffing shortages. And I think that I don't believe that, at least to my knowledge, that's not directly related to COVID, but just trying to manage the really difficult challenges of life in the times of COVID-19.
Okay. And last question for Dr. Farley. Are you aware of how many available hospital beds for the surge that could happen, and how many medical staff would be available?
We have a sense for how many beds are available right now, and also a sense for how many additional patients they could handle. Just the fact that they're now 60% lower than they were at peak as far as number of COVID patients is one measure that we could easily double the number of COVID patients and they could handle them. Now, they're available beds they've used for other patients right now, and I think that there's nothing inappropriate about that. But we do think that there's definitely spare capacity right now. As far as number of employees, we don't have data on that.
Thank you both.
Thanks, Martin. We're going to go to Cheryl Spreitzer of 6ABC.
Hold on. Hey, sorry, Brian, back for you. In regards to the officer from the 9th District, was that a COVID-related death?
Yes, that was a COVID-related death.
Okay, thank you.
As was firefighter Gore.
Okay, that's what I thought. Thank you.
And Rudy Chinchilla with NBC 10 Telemundo.
Hi, guys, and I actually apologize because I'm going to have you guys repeat an answer that you already gave, but I'm hoping you can give it in Spanish. Armando, si me puedes ayudar. La pregunta es la misma que hizo Jason Laughlin, que ¿habrán protecciones para los trabajadores que no se sientan seguros regresando al trabajo?
The question is, will there be protections for workers that don't feel safe coming back to work?
I'm going to try and be more concise than I was last time, Rudy, for Armando's sake. We will have health department and L&I employees who are available to respond to businesses that may not have taken appropriate precautions, either for their workers or for their customers, to both educate and enforce the guidelines that we'll present, and would encourage workers that feel unsafe or feel that their employer isn't following appropriate guidelines to call 311 in order for us to address those issues. I don't think the city can intervene if an employer is doing what we've asked them to do and what our guidelines dictate between an employer and an employee.
Thanks, Brian.
Voy a tratar de ser un poco más conciso que la última vez que respondí esta pregunta. Vamos a hacer que el Departamento de Salubridad de la ciudad y el Departamento de Licencias e Inspecciones respondan ante los negocios que no estén cumpliendo con las precauciones que se les ha indicado, tanto en el cuidado de sus clientes como en el cuidado de sus trabajadores. Nosotros vamos a intentar de educarlos con respecto a las pautas y directrices, nuevamente, tanto a los trabajadores como a sus patrones. Y cualquier empleado que piense que no se está cumpliendo con estas directrices siempre puede llamar al número 311 para tratar de resolver esos temas. La ciudad, sin embargo, no puede intervenir en casos en los cuales los patrones están cumpliendo con las pautas que se les ha indicado.
Gracias, Armando. Thanks, Brian.
You're very welcome.
Great, thanks, Rudy. We're going to go to Perla Lara of Impacto.
Yes. Can you hear me?
Hola.
Hola, ¿qué tal? La pregunta es sobre el seguimiento que le puedan dar a las fuerzas del orden, que hemos visto que muchos de ellos no están pues llevando protección, cubrebocas, y que pues hay mucha gente que los está inclusive hablando así de frente, y obviamente sabemos que eso está transmitiendo el virus. Entonces mi preocupación es a todas estas fuerzas del orden, tanto locales como estatales, federales, que están conteniendo las protestas, ¿se les va a dar algún seguimiento especial? ¿Y por qué no están usando todos el cubrebocas?
Muy bien, Perla. My question has to do with, will there be a follow-up with law enforcement personnel that have been seen not wearing covers, not covering their mouth when they've been speaking, not wearing masks? And when people speak, that's when they transmit the virus directly. So is there any plan in place to look out for law enforcement from the state or federal forces that are here and are not complying with the protection orders?
So we are actively at, and I've watched our commanders do it in my presence, trying to make sure our officers are wearing masks when they are either on the scene of a crime or interacting with the public, both for their protection and for the public's protection. And generally, although not perfect, I think our officers are doing a fairly good job. And continue to work through that on a regular basis. As it relates to, say, the National Guard, I do not have the enforcement ability to order them to wear masks. We've certainly spoken to their leadership and expressed that we would like them to. But again, they are, while we have some oversight over how they're deployed and what their interaction looks like, as far as their equipment, it's not something that we can dictate.
Bien, nosotros activamente hemos observado a nuestros comandantes y oficiales de alto rango de las fuerzas policiales al hacerlo y el indicarle a los oficiales de policía de rango que utilicen los cubrebocas o las mascarillas, tanto en la escena de los delitos como en sus interacciones con la gente, para protegerse a sí mismos y para proteger al público. Generalmente pensamos que ellos han estado haciendo muy buen trabajo con ello. Con respecto a la Guardia Nacional, nosotros no podemos dictarles órdenes de ese tipo a ellos. Nosotros podemos hablar con sus superiores y sugerirles y recordarles que nosotros quisiéramos que ellos utilicen la protección debida y necesaria. Nosotros podemos indicar dónde desplegarlos y podemos indicar cómo pueden actuar, pero no podemos indicarles qué usar o qué ponerse. Gracias.
Sí, ¿les van a dar algún seguimiento? O sea, ¿van a darles test o se van a estar cuidando ellos? Porque, bueno, han estado expuestos y ellos no pueden enfermarse. Entonces, ¿hay alguna forma de que ellos sí tengan prioridad para poder acceder a los test?
¿Se refieres a todo el personal de las fuerzas del orden?
Al personal de las fuerzas del orden, ajá, sí,
En
porque
general.
obviamente no van a todos los protestantes no van a poderles hacer un test, pero a la gente que está ahí, porque está recurrentemente en las calles y está recurrentemente también recibiendo cómo le hablan directamente y les escupen muchas veces, vaya, no intencionalmente, pero sí les están hablando de una forma agresiva también cerca de ellos. Hemos visto muchas imágenes y bueno, ellos no están protegidos. Realmente para mí la preocupación es salvaguardar en este caso la salud de la fuerza del orden.
Bien, muchas gracias, Perla. This follow-up question is if there will be a follow-up with testing for law enforcement personnel that may have been exposed, will they be given a priority in having access to testing? Because we've seen not necessarily protesters, but law enforcement personnel that are out in the streets, they're speaking. In some cases, the interactions are a little heated, so there's spit coming out either to them or from them, and of course not intentionally in their case, but there's been aggressive interactions, and we are concerned about the well-being of law enforcement personnel and wonder if there will be a follow-up and special testing for them.
Thank you, Perla, and thank you for the concern over law enforcement personnel. They've had a hard few days, and appreciate that. Law enforcement, public safety, and essentially all of our first responders and staff that have been really on the front lines of this crisis since mid-March have had access to testing, and will continue to have access to testing going forward. And that testing generally has been, we've advised to go to a lab or one of the pharmacies that are doing testing, and that's covered by the employees' health insurance. But so that they should absolutely and should be able to manage that.
Gracias, Perla. Yo agradezco esto porque nuestro personal de apoyo ha tenido unos días muy difíciles últimamente y se lo agradezco. Por supuesto que han sido las primeras personas que han respondido, el personal de las agencias del orden y los trabajadores que desde mediados de marzo han tenido acceso a las pruebas y van a continuar teniéndolas. Ellos pueden dirigirse a un laboratorio, a una farmacia o a los centros de prueba que aún siguen abiertos, y esta prueba está cubierta por su seguro médico.
Gracias.
Thank you.
Thanks, Perla. We're going to go back to Hannah Seawald at the Temple update.
Okay, yeah, just one final question. So I remember around Memorial Day weekend, it was recommended that Philadelphians refrain from going to the Jersey Shore. Should Philadelphians still refrain from going to the beaches even in the yellow phase, or what is the advisory there?
We're not recommending that now as part of the general, not recommending social and religious gatherings.
Okay, great. Thank you so much.
Having said that, I will say, some people did get together over Memorial Day, and there's no evidence in our data that caused an increase in transmission. I'm not changing my recommendation, but at least I'm pleased that so far we have, the gathering that has taken place has not caused us problems.
Great, thank you.
Thanks, Hannah. We're going to go to Edgar Ramirez now of Philatinos Radio. Edgar, you just have to unmute yourself. Let's see here.
Armando.
There we go.
Te oigo, Edgar. Buenas tardes.
Saludos, Armando. ¿Cómo están? Sé que todo es apremiante, pero tengo una pregunta. En el sur de Filadelfia tenemos alrededor de 30 restaurantes mexicanos pequeños. Sé que la ciudad por ahí tiene el proyecto de espacios abiertos afuera. Ninguno de nuestros negocios sirve comida afuera. ¿Sabes si va a haber alguna forma o oportunidad de que estos empresarios mexicanos apliquen para tener ese espacio?
¿Para tener espacio para servir comida afuera?
Ajá, por si ponen mesas afuera en la parte de sus negocios.
Requieren un permiso. ¿Bien?
Ajá.
Bien. My question is in regards to the restaurateurs in South Philadelphia. There's about 30 small Mexican restaurants in the area, and they don't have outdoor sitting space that they use. They're not accustomed to doing that. So they are not able to serve food in the outdoors for now. Is there a permit they could apply to? Will they be given an authorization to be able to sell their food outdoors?
We'll provide those guidelines next week, but there's a number of restaurateurs across the city that don't normally provide outdoor dining that will want to. We are working on streamlined processes to allow that to happen, and we should have more information next week.
En respuesta a tu pregunta, Edgar, van a haber pautas que se van a diseminar la próxima semana para los propietarios de restaurantes en el centro de la ciudad restaurantes que normalmente no sirven comida afuera, pero van a querer hacerlo. Y nosotros estamos todavía afinando esas pautas y las vamos a publicitar la próxima semana.
Armando, muchas gracias. Brian, muchas gracias.
Thank you, Brian.
De nada.
Gracias, Edgar.
Thank you all. That concludes our questions for today. And we will have a 2 p.m. briefing on the updates to ongoing demonstrations that will not be held on Zoom, but at the Fire Administration Building. So if anyone has questions, please email press@phila.gov. Thank you.